Everywhere we go, the big question is always, what's next? Where is HSCI going from here?
Every time we've had a new discovery, we get that question.
But where do we want to be a decade from now?
In the clinic, of course, no question, back to your home in the hospital. Our goal for the coming decade has to be to move these discoveries into clinical trials. And from there, of course, into patients who need them. They're waiting for them.
But in what areas?
Well, I think we can promise that in the next decade, we'll be talking about how HSCI scientists
Cured diabetes.
and improved the safety and success of stem cell transplants in cancer, created effective treatments for ALS and Parkinson's, and actually made some clinical progress on healthy aging.
And I think we'll have some additional breakthroughs. After you.
Thank you everybody for being here. This is my friend Dr. Andrew Wells. We went to Palmer out in Iowa together. He came up from North Carolina to help us kick this off. So I'm really excited. This is some really, I call it cutting edge technology, but it's stuff that's been around for many years. He's been working with practice for many years doing this. So if you guys pay attention, I promise you're going to get something great out of this. And we hope we can help you guys out. So
Awesome.
take it away.
Thanks, man. Hello, everybody. Nice to meet you all. Dr. Wells. Anyone been to Asheville, North Carolina? Nice. For vacation? It's nice, right? All right, well, that's where I'm from. So good to have you guys here today. And like Dr. McKinney said, this is, people ask me, is stem cell therapy new? Has regenerative medicine been around for a while? It's actually been around since the 80s and 90s. So the video from the Harvard Stem Cell Institute talks about some of the breakthroughs that are happening with regenerative medicine. So it's a really exciting time to be in medicine. If you could hear it on the video, they talked about actually having cures for things like cancer, diabetes, heart disease, things that Americans have suffered with for a long, long time, have had treatments for, medication treatments for, but no actual cures for. So the information we're going to share with you today is absolutely life-saving. And I don't mean, when I say life-saving, I don't mean it's going to bring you back from the dead if you have a heart attack, but if you've been living with joint pain for 5 years, 10 years, 15 years or longer, then you know that robs you of your life and not being able to do the things that you want to do. And so to be able to give that back to our patients and people, not only to feel better, but to actually be able to use your body the way you want to use it as you get older is a pretty powerful thing. So we've been at this now. We've been doing regenerative medicine for 7 years now, and we've seen hundreds and hundreds of patients go through these protocols and do really well. So I'm excited to share this with you today. So if you look at, again, that video is from the Harvard Stem Cell Institute. If you go to any major hospital / teaching institution, they have some sort of regenerative medicine or stem cell program. So almost every hospital now is using stem cell therapy for something. It's actually started back in the 80s and 90s. They used it mainly in California if you wanted to look younger. So if you wanted to have less wrinkles and look like a movie star, that's what they were using it for originally. It's been used for joints. It's been used for stem cell transplants for people with cancer. So all kinds of applications. We're using it to help people with pain. And so that's what we're going to be focusing in on today. So our goal today, we have like three main missions. Number one is to help you feel better. That's probably why a lot of people are here in the building. Number two is how to avoid unnecessary medications and drugs and surgery. And then finally, I think, in my opinion, the most important one is help you maximize your quality of life and function. And we'll talk a lot today about what it means to be pain-free. And pain-free is great. And there are a lot of things that get rid of pain, but there are very few things that restore function. So raise your hand if you know people that have had like surgeries, like back surgery, knee surgery, and they feel better, but they can't really do what they want to do. Like they can't go play golf or get on the floor and play with grandkids. They're doing some flooring upstairs. I don't know if you guys can smell the dust, but like getting on the ground and like installing flooring. So sometimes it affects your personal life, your work life. And so if you can't use your body the way you want to use it, it's a huge disruption. So my goal today, and people laugh when I say this, but when you leave here in an hour, you will know way more information about stem cell therapy and regenerative medicine than your doctor. And I know that sounds funny, but I promise you that's the case in almost every case. We had a lady recently, she came to a seminar like this, and she goes, I asked my doctor about stem cell therapy, and she told me it was only for terminally ill patients. I have no idea where that came from, but that's what her doctor told her about regenerative medicine. So there's a lot of information. So if you go home and Google stem cell therapy or regenerative medicine, you see all kinds of pros, you see all kinds of cons. Some of it's relevant information, some of it's not relevant. So my job today, when you leave here, you'll know what it is, what it's used for. If you're a good candidate for this, we'll really clear that up for you. So All right, so 3 things we'll talk about today. This is what we're going to cover in the next hour. So we'll talk about conventional therapies for joint pain. We'll talk about what regenerative medicine is and what the different types are. And at the end, we'll talk about cost, how much it is, and what the next step is. So if what we talk about today makes sense to you and you feel like this is potentially a good option for you, we'll talk about what the next step is to see if you're a good candidate. All right, so if you don't mind, hold your questions until the end. The first time I did this seminar years ago, I answered questions as we went along, because a lot of people, as we go through this, they had great questions. And so I was answering questions as we went along. It literally took us about 2.5 hours, and 2 guys fell asleep in their chair when I was doing it. So I'm like, all right, I'm not answering questions. So all of the stuff I'm talking about today, this seminar is made up of all the questions I've had over the years, and I've put it into like a seminar format. So I promise you I'll answer 99% of the questions you guys came in with. And then if there are questions that I haven't covered, at the end, I'll stick around as long as necessary, and I'll answer any personal questions you guys might have. Fair enough?
Yeah.
Cool. Oh, and if you have a cell phone, if you don't mind turning it on silent, I would appreciate it. Okay, so just big picture stuff. What is a stem cell? So a stem cell is basically a cell that can turn into different types of cells. So a stem cell can become a cartilage cell, a ligament cell, a muscle cell, a bone cell, a nerve cell. In fact, when you were born, so I don't know if you all know Silas, Dr. McKinney's little boy, so he's like full of stem cells. So when you're a little baby, you have tons and tons of stem cells because your body's growing really quickly, and then as you get older, those cells sort of go away as you go through time. So question for you guys, raise your hand if you're here because you're hoping this is going to help with something that you're struggling with. Okay, cool. Raise your hand if you're here because Dr. Josh or Dr. McKinney told you to be here. All right, cool. All the employees raise their hand like, yeah. All right. Are you paying everyone for this? All right. And then if you're here, raise your hand if you're here because you're just kind of curious about what this is, or this is better than watching Netflix at home. All right. And then raise your hand if no matter what I tell you today or ask you, you're not going to raise your hand in front of a group of people you don't know. All right. Fair enough. Fair enough. All right. So the reason this is important is when we talk about regenerative medicine, like where does this fit in the scope of therapies and options that you guys have? So we'll talk about today this big concept. You have degenerative conditions and we talk about regenerative conditions. So degeneration versus regeneration. So if you have a degenerative condition, meaning you've lost cartilage in your knee, you have arthritis in your back, shoulder, in your joints. Whoop. Am I okay still? Okay, I'll stuff that in my pocket. So if you have a degenerative condition, when does that stop getting worse? At what point in life? Take a guess.
Never.
Never, yeah. So degenerative conditions are what are called progressive. And so progressive conditions mean they just get worse over time. So in other words, I've never met someone who had a bad hip and they woke up one morning and they're like, wow, I had a really deep sleep. I think my arthritis in my hip is gone, right? It doesn't sure, miracles can happen, but so degenerative conditions just with time and gravity and just, life, they get worse over time. So it's only a matter of time before it gets worse. So unless you have something to actually stop the process from getting worse or actually reverse it, it's just a matter of time before it gets bad, if that makes sense. So up until now, we haven't had the tools to be able to reverse or stop degeneration. And this is the huge concept I want to go over today. We now, with regenerative medicine, have the tools to do exactly that. We have the ability to stop and actually, in some cases, reverse the signs of damage and wear and tear in joints. So that's why this is really exciting. So let's talk about, I want to give you some pictures of what arthritis actually looks like. So this is a picture of a knee, and you have 4 stages of arthritis. You have, on the left, you have stage 1, 2, 3, and 4. So stage 1 on the left, this is early degeneration. Most people in stage 1 have no idea they even have arthritis or degeneration because they don't feel it. They can use their joints just how they want to use them. There's no pain. Sometimes you may have a few symptoms, but overall you don't really feel it. When you start to get into phase 2 or stage 2, this is when you start to see the space in between the bones start to get smaller. Stage 2 is typically when people start to feel pain. Like, so for example, when you wake up in the morning, you get out of bed, things feel stiff. It takes a while to kind of warm up your joints. Some people in stage 2 don't have any symptoms. They don't even feel it. Then you get to stage 3, and this is when it's pretty easy now to start to see, like on an X-ray or an MRI, that you have some damage. Most people in stage 3 have a tough time doing chores, doing fun stuff, just using their body the way they want to. Then you get into phase 4. So this is sort of the end of the road. This is where you hear the term bone on bone. Raise your hand if you've heard the phrase bone on bone degeneration. Everybody always raises their hand. So here's the great news about this. Most people that come to this seminar have been told they have bone on bone degeneration. 99% of people who have heard that don't actually have bone on bone degeneration. So that phrase gets tossed around very, very loosely. Most people that have been told they have bone on bone are in stage 2 or stage 3. If you're in stage 4, this is typically people that have like wheelchairs, walkers. They have a tough time just getting in the building. So if you have stage 4, that's when the joint just doesn't want to work. So in a perfect world, ideal setting, in what stage do you think would be the best stage to do something like regenerative medicine? In a fantasy world. Yeah. So stage 1. So the earlier you catch this degenerative process, and the more you can help it, if that makes sense. So most people that we've helped over the years have been in stage 2 and stage 3. When you get to stage 4, regenerative medicine is not going to do a whole lot. So regenerative medicine is not a magic like cure pill wand that you can wave over this and make it go back to stage 1. So the earlier you catch it, typically the better the results are. Does that make sense? So earlier is better. If you're looking at it through the lens of surgery, so if you're a surgeon and you're looking to replace this joint with an artificial joint, what stage is the best stage to do that? Say again?
3 or 4.
Yeah. So 4 is ideal, right? You want to get as much use out of that joint as possible until you have to have it replaced. So a lot of people end up here because they've been to their surgeon, they've been to a specialist, and they've been told, you have arthritis, we don't want to operate now, come back in 5 years, come back in 10 years when you can't walk anymore or can't use the joint, and then we'll replace it. So the question is, well, what do you do between this time and the time it actually wears out? In most cases, you've been told, go home, take pain medication, and kind of live with it. So we actually have the tools to be able to fix it now. So this is an example of a shoulder. This is an x-ray. It's kind of tough to see here, but this is like the ball and socket joint with a worn out shoulder. Well, the normal shoulder, you should see a nice like little black line here. That's where your arm bone meets your shoulder blade. Over here on the right, you can see very little space left, and this big bone spur that's developed on the shoulder, that's like a stage 3 degenerated shoulder. So you have hands. We've had a lot of people come in with arthritis in their thumbs, their fingers, which is really painful. Regenerative medicine can help with that. And then spine. So a lot of you are probably here because you have had back pain or neck pain over the years. So the degeneration process, stage 1 to stage 4, works the exact same way in the spine. You have a loss of disc height. You have bone spurs, arthritis that starts to develop in the spine. All right, so did everyone get one of these little surveys, one of these guys? Did anyone not get one? Okay, so when you fill this out, just be honest on this thing. Not that people would lie, like, I don't have that, but just be honest on it. What I mean by that is some of you are here because you have, like, for example, a knee problem. And knee problems eventually lead to what? Hip problems, back problems, like the old song, like the knee bone's connected to the hip. Very, very relevant here. So some people are like, all right, I have, this is common. We had this guy come in and he had a really bad knee, and I'm like, how's your back doing? He's like, oh, my back's fine. And his wife's like, your back's not fine. Your back's horrible. She's like, yeah, he's got back problems. And I'm like, well, how's your hip? And he's like, yeah, my hip's fine. I don't want to talk about my hip. And his wife's like, his hip's not fine. So he was thinking of like, oh, this guy's going to try to get me to do injections in all my joints, and not the point. But the point is that a knee problem affects other problems in your body. So if you have multiple problems, put all of them down here and then rate them on a scale of 1 to however many you have. So if your back problem's number 1, put a 1 by it. If your shoulder problem is the second worst, put a 2 by it, and kind of rank them. It gives us a better idea of what's going on underneath. Okay. So we're going to compare sort of conventional methods with regenerative medicine. So with conventional methods, you're looking at, and we'll talk about these in a minute, but you're looking at mainly masking symptoms. So you go to your doctor, you have joint pain. The goal is, how do we get this person out of pain? The problem with conventional therapies is they, in most cases, do very little except mask the pain, doesn't address the root cause, or just treating symptoms, and they have a lot of side effects, which we'll talk about in a minute. So you have conventional medicine and regenerative medicine. Regenerative medicine is different because it helps your body repair itself. It gets to the root cause of the problem, provides your body with what it needs to help heal and function, so you get better function, less pain. And the cool thing about regenerative medicine, there's no side effects. And people sometimes look at me like, funny, like, really? Like, there's no side effects? The reason there are no side effects is it's not a drug, it's not a chemical, it's not made in a lab. It's a human cell in a human body. There's nothing for your body to reject or have a reaction to. So in the I don't know how many hundreds or thousands of injections we've done, we've never had a patient have an adverse side effect other than a little redness where we did the injection. So it's really, really easy. So if you have, let me back up a minute. If you have joint pain, what are the three common therapies we use? So in other words, if you go to your doctor and you're complaining of joint pain, what are like the three things we do? Yep, NSAIDs. You cheated. You saw that next slide. Or you're just really good. You knew that. Okay, so we have NSAIDs. So we have medication, right, like pills. What happens when the medications don't work anymore? Yeah, physical therapy is right. I'll leave.
Then physical therapy.
Sometimes, yeah. I'm going to leave physical therapy out for just a second, but whoever said that, you're absolutely right. What comes in an injection form for joint pain?
Oh, cortisone.
Cortisone, yeah. Raise your hand if you know someone who's had a cortisone injection before. Very, very popular. We'll talk about that in a minute. And then, so when the drugs and the cortisone doesn't work anymore, then what do you get? Surgery, yeah. So that's the last option. So if you look at those, so if you look at medications, cortisone, and surgery, would you say those are regenerative or degenerative? Yeah, yeah, so they're degenerative. The therapy itself is degenerative. So what do I mean by that? So if you look at NSAIDs, anti-inflammatory medications, so you have joint pain, you take an ibuprofen, take an Advil. So this is a quote from Dr. Fries of Stanford University School of Medicine, and he guesses every year between 10 to 20,000 people die from the side effects of taking something you can get at CVS with no prescription. So, when we think about, we're sort of in the middle of a pandemic, and sadly, people have died from this, and it's a huge issue. And unfortunately, a lot of people have died from that, but it pales in comparison year after year from how many people die from therapies for joint pain. It's not even close. And this is stuff you can, again, buy at a pharmacy. So if you look at, this is a big one. So if you look at opiates, unless you've been living under a rock, there's a massive opiate epidemic in the US. So people go into their doctor because they have joint pain, they're prescribed painkillers. What's the problem with opiates? They're habit forming, they're addictive. And so people get used to that and they get addicted to it. It causes constipation, drowsiness, vomiting. It's dangerous to drive, and also a decreased sex drive. So raise your hand if you want any of those things, right? So we're trading lack of pain for side effects. And there's a whole other issue with being addicted to opiates, but that in and of itself kills tens of thousands of people a year. Cortisone injection, this is sort of the go-to therapy for joint pain. It's the nice thing about cortisone, it's a very powerful anti-inflammatory. So you get an injection and people feel great for months, sometimes longer than that. But the problem is it's a very degenerative process. The more cortisone injections you have, the faster your body breaks down. So this is why you can only have typically 4 cortisone injections per year, because it eats away at your bone, your muscles, and ligaments. So not only does it just cover up the pain, it makes the arthritis worse. And it also causes other issues. So it can cause cataracts. If you're diabetic, it can really jack up your blood sugar levels, and it also suppresses your immune system. So it has other complications as well. And then, so here's why I kind of put this in perspective. You've all seen on your dashboard before. So imagine you're driving down the road and you see that bad boy pop up. It's like, check engine light. So imagine you take your car to the mechanic and you're like, hey, my check engine light came on. What's wrong? And so the mechanic says, I don't know what's wrong, but give me 5 minutes, I'll fix it. Be right back. And so all the mechanic does is put a little piece of tape over it, and all right, you're good. It'd be $2,000, right? So obviously everybody knows that's not a fix to the problem, right? It's just covering up the problem. You don't see it anymore. Eventually your car is going to, could break down. So if that's an insane way to take care of your car, it's also an insane way to take care of your body, right? So you have pain medications, cortisone, in some cases surgery is not fixing the problem. It's just making it so you're not aware of it anymore. And so if it's crazy to take care of your car that way, it's also crazy to take care of your body that way. But the problem is we haven't had the tools to fix it, right? We're living in a very, very archaic way of taking care of joint pain. That masking symptom approach is changing, thankfully, but it's been done the exact same way for like the last 80 years. Nothing's really changed in orthopedics. Does that make sense? So now we actually have the tools to be able to do this. So if you're squeamish, don't look at the picture here on the right side, but some things to consider before surgery. There's no guarantee of results that surgery is going to fix the problem. And I hear this all the time. Dr. Wells, I'm going to get it fixed. I'm going to have surgery. I'm going to get it fixed. Funny story, like one of the first seminars we ever did, I got a knock. We did a seminar, I think it was 1 o'clock. I got a knock on our office door at like 7 in the morning, and I was the only one there. I opened the clinic door. There's this guy standing there. He goes, you're Dr. Wells. I'm like, yeah. He's like, I'm coming to your seminar later today. I'm like, all right, you're like 6 hours early. I'm like, what's up? He goes, yeah, I did all my research on regenerative medicine. I think I want to have it done. I don't know if I want to come to your workshop. The only question I have, is it guaranteed to work? And I'm like, no, not guaranteed to work. He's like, He's like, yeah, I thought you were going to say that. And he goes, okay, well, cross me off the list. I'm not coming. I'm like, okay. I'm like, why are you here? Like, what's going on? I'm like, what's the deal? And he goes, yeah, he goes, I'm not really sure if I want to do that. I think I'm going to have surgery first. I'm like, okay. And I'm like, well, what's wrong with you? And he goes, I have 2 bad knees. And you could tell, like, he was walking really stiff. I have 2 bad knees. Doctor's going to replace both of them at the same time. And I said, okay. And I said, well, I have one question for you before you leave. And he goes, what's that? And I said, is surgery guaranteed to fix your knee problem? And guess what he said? He said, yep. He goes, yeah, guaranteed. I'm like, what are you talking about? Guaranteed to work. And I'm like, no, that's not guaranteed to work. He goes, yeah, I had a couple buddies, they did fine. They had their knee, they did okay. I'm like, okay, so if it's guaranteed to work, why haven't you done it yet? You're here. I can tell you're in pain. And he kind of like, he looks down and he goes, well, I just hope it's going to work for me. He goes, honestly, I know a lot of people that have had joint replacements and they didn't do that well. I'm like, okay, great. So if anyone tells you that something is guaranteed to fix your health problem, run. Like, there's nothing that is guaranteed to fix a health problem. In fact, if people claim that, they're lying. That's unethical. But especially with the problem with surgery, there's a very high percentage of failures and complications. So in other words, raise your hand if you know someone who had like a joint replacement or a back surgery and they did really well. Like, I know lots of people like that. They did really well. I got a really bad car accident, broke my neck in 3 places. If you look at my neck, I have a little scar here. Thank God I had surgery. It saved my life. My neck's doing still okay now after about 3 years. Raise your hand if you know someone who had surgery and it was like the worst decision they ever made and they wish they could take it back. Yeah, we all know people like that too, right? So there's no guarantee of the outcome. And so, especially with artificial joints, so if you're looking at like a shoulder replacement, a hip, a knee, these things wear out over time. They're just like tires on a car. So an average artificial knee or a hip will last you 15 years. And so the problem is, if you're 60 years old now and you have a knee replacement, there is a high chance that when you're 75, 80 years old, you're going to have that redone, taken out and put back in. And I don't know about you, but having surgery at 75 years old, like a major operation, is not safe. It's not good. And then you have things, it's painful, expensive. There's a long rehab time, lost time, a time away from your family, work. There's a lot of things that factors that go into having surgery. So a couple other things to consider. The risks are bleeding problems during surgery, blood clots, difficulty breathing from the effects of anesthesia. So if you look in the lower hand corner, infections after surgery is that they claim a rate of 4 in 100. So 7 years ago, my dad had knee pain. And so he had gone to the doctor for years, and he'd, typical stuff, pain medication, cortisone injections. He'd been through all the series of cortisone injections that he could have. And so the surgeon said, it's time to think about surgery. And so the doc gave my dad 2 options. He said, my dad really didn't want to have surgery, but he's like, what are my options? And he said, well, you can continue to live with knee pain, or you can have surgery. Which one do you want to do? And my dad said, well, let's fix it. Let's get surgery. So he went in for the operation. Now, my dad didn't have a knee replacement. He had arthroscopic surgery, which is where they make a couple holes in your knee. They're going to clean up the knee. And went in for it, had the operation, came out of the operation, and he was going through rehab. So he's in the rehab hospital. They were doing all these like PT stuff for his knee. And my dad's like, my knee feels worse. And the nurses were like, well, that's normal. You've had surgery. Your body will feel better. Just give it a couple weeks, it'll feel better. 2 weeks goes by, pain was worse. About a month goes by, and my dad's like, my knee is killing me, like something's wrong. And so the doctor, did it re-examine, like, well, you have an infection. They did some blood work. You have an infection in your knee. And it was clear that he had an infection. And so they put him through all these protocols to try to clean up the infection. Nothing was working. They eventually sent him to a different rehab hospital. And so my dad got to a point where he walked into the surgery, never walked after the surgery. And so get this, after 6 months in a rehab hospital, they sent my dad home. Couldn't walk, still in a ton of pain. Any guesses why exactly 6 months they sent him home? Medicare stopped paying. So Medicare stopped paying, Blue Cross Blue Shield stopped paying. They said, we've done everything we can do here. You need to go home. And so we took my dad home. He was living by himself at the time. And he was never able to get up out of his chair to use the bathroom. And so he was sitting in his chair, couldn't because of the pain. If no one was there to help him, he wasn't getting out of his chair. And so, if you've ever seen a family member like that, it's devastating. So we checked him into a different rehab hospital, kind of desperate at this point, all out of pocket at that point. And my dad spent the last 3 months of his life trying to recover from a knee operation, eventually passed away. So I saw my dad, who was like a 6'4" big guy, was half my size 9 months after the operation. And understand, like, this wasn't like he went to a reputable hospital in Chicago where I'm from. Surgeon had done thousands of these. Had we known that this was going to be the outcome, obviously we never would have done that. I mean, he was in some pain, but still walking around, and that was the outcome. And I remember my sisters were like, oh, we should sue the hospital. Like, that shouldn't have happened. It's like, well, you signed the piece of paperwork before surgery that says you could die from this thing, right? You never expect it to happen, but that's what happened. We had no idea that regenerative medicine was an option for my dad. I'd never heard of it. I didn't know it was an option. The surgeon didn't present that as an option to my dad. I saw a picture of his knee, an x-ray of his knee. It wasn't that bad. It wasn't great, but it wasn't that bad. He was like a stage 2.5. And that was the outcome. And so I get really passionate about this because if we can help one person avoid what my family went through, like that's a life saved. And so we just didn't know that this was an option. So part of the reason I'm here from Asheville when I come up here to do this is because we've helped a lot of people avoid going under the knife. And so if we can help you do that, that's great. So deaths, 1 in 400 deaths after a total knee replacement. And by the way, the hospital did not rule my dad's death as a result of surgery. I don't know what they did, but it wasn't anyone's fault, right? That's just what happens in hospitals. Okay, this is a really interesting study. This came out of Ohio. This is a workman's comp study. So they took 1,450 people who had back injuries on the job. So they took half the group and they did surgery to fuse 2 or more segments in their spine. The other half of the study, they did nothing. So this group just went home. Guess what group did better? The surgery group or the no surgery group? The no surgery group. So here is the end result of the study. They found that of the people who had surgery, 26% of those people were back at work 2 years later. The people that did nothing, so no surgery, no therapy, they just went home and did nothing, 67% of those people were back on the job after 2 years. So the study showed you were 3 times more successful doing nothing than going under the knife. And sometimes we think of like, well, surgery must be better because it's complicated and you have to be smart to be a surgeon, but doesn't mean you're getting the most complicated. Sometimes the simplest thing is the best outcome. And that surprises people sometimes. But here was the scary thing about the study. Of the people who had surgery, they found out afterward, almost half, so 41% of the people were taking more pain medication than they were before the surgery. And so the scary thing about this is that the painkiller they were looking at specifically were opiates. And so when you wonder, like, well, how do people get addicted to opiates? Most people that get addicted to opiates, and sometimes even like heroin, heroin addiction often comes from opiate addiction. It's because people had an injury and whatever therapy they tried didn't work, and sometimes they were worse afterward. And so this is how people get hooked on these types of medications. By the way, the good thing about this outcome, Ohio was the first state, so back in January of 2018, if you have a workman's comp injury, a spine injury in Ohio, you have to do alternative therapy first before you go under the knife, because because people get better that way. You don't need to go under the knife. So pretty cool, right? So that's finally a state's like actually doing something about the opiate epidemic. So raise your hand if you've had a shoulder surgery before. It's a trick question. You can't raise your hand anymore. I'm teasing, but not teasing. So this is another tough one. So if you've had a major tear in your rotator cuff, the successful outcome is 43%. So remember what grade you got in school if you got a 43% on your test? It's like F minus. So that's our national statistic for major rotator cuff surgeries. And then you have knee replacement. So this is a pretty common one we see. This is a quote from the New York Times. They looked at a large study of people who had knee surgeries, and they found that a third of the people who had gone through a knee operation didn't actually need the knee operation. So why would doctors recommend a knee surgery if the patient didn't need it? I'll let you guys come to your own conclusion on that one. Yeah. So options, just to kind of recap, you have more medication, you have surgery. This is by far the most common option. The do nothing option is just kind of hope it goes away. I've been very guilty of this in the past. And then there's the regenerative medicine, which we'll talk about in a minute. So I don't know if you can read this or not. I love this cartoon. It says, we've exhausted all conventional measures. One last desperate option is to put you on an alternative natural medicine that has a 96% success rate. This is healthcare in the US right now. It stinks. So here's the problem with this, and this makes sense to a lot of people. Let's say you get an injury. Let's say the first thing you try, like raise your hand if you know someone who's died from a stretch that their physical therapist gave them. You do? Really?
Wait, a stretch?
Yeah. Oh, I was going to say, man, that would be like a first one. The answer is no. No. Yeah, so like nobody died. Like no one dies from chiropractic. No one dies from. Let's say you went home and took some turmeric, right? Like some anti-inflammatory. No one dies from that. So let's say you tried physical therapy, you tried chiropractic, you tried acupuncture. That didn't work. That stinks. But guess what? You can always try more things, right? You're still alive. There's nothing to reverse. So let's say you tried those things and it didn't work. Then maybe you try regenerative medicine. Let's say worst case scenario, regenerative medicine didn't work. That stinks. You have options still. Then maybe you try medication, cortisone injections. All the way over here you have surgery. So as a last resort. The problem in the US typically is we do drugs and surgery first, all the dangerous things that don't have the best outcomes. And when that doesn't work, then you try all the hippie therapies over here, right? But it's backward. It should be the other way around. And so, unfortunately, we have sort of an outdated healthcare system that is, in my personal opinion, more about making money for drug companies and the people that do surgery and less about actually helping people. And so, I know tons of people that have been helped by Dr. McKinney and Dr. Josh and the staff here. Like, this stuff works, but if it doesn't work, you have options, right? Worst case scenario, what's the worst case scenario with surgery? Worst case scenario. You're dead. Yeah, you're dead. Less than worst case scenario, you have it done. Let's say you have a knee replacement and maybe it helped with a little bit of the pain, but you still have some pain left. You can't undo that. Once it's done, it is done. It's a final thing. And so, cross your fingers, hope and pray it goes well, but sometimes it doesn't. Okay, switch gears a little bit. So we're going to talk about stem cells, how this actually works. So again, a stem cell is just a cell in your body that has the ability to turn into other types of cells. That's a stem cell. So, I don't know if my little cartoon works. Yeah, so stem cells can become, the other thing stem cells can do is they can make other stem cells. So a stem cell can make a copy of itself. So it can make more stem cells, or they can turn into specific types of cells in your body, like muscle cells, bone, fat cells, and cartilage, and really any cell in your body a stem cell can become. So in the US, you have a couple of different types of regenerative medicine that you can do. So one option is you can get cells from your own body. These are called adult stem cells, and I'll talk about those in just a minute. Another option is using cells that are harvested from the birth process. So these are called amniotic cells, placental cells. I'll talk about what that is in a second. And then you have, and by the way, these cells, sometimes people ask me, like, does that come from aborted babies? That's illegal in the US. So if you wanted to get cells from aborted babies, you have to go outside the country. It's not legal. You can't get them in the US. These cells come from mothers who voluntarily donate their amniotic tissue after having a scheduled C-section. So mom goes home with baby, and the cells are used for things like regenerative medicine. So then embryonic is the other kind that you get from aborted babies. So let's talk about adult stem cells for a minute. So you have two options here. You have bone marrow and fat cells. So bone marrow is, a doc will go into your hip bone, and they take out some bone marrow from your hip bone, and they in that bone marrow it's a very rich source of stem cells, and they use that for your injection, so it comes from your own body. Fat cells, this is just like liposuction. So they suck fat cells out of your belly, and then they activate the stem cells and inject them back in your joint. Sounds pretty cool because you get liposuction. You know what? Yeah, it's like, yeah, sign me up. I want that. So here's the twisted thing. Get this. So in the FDA in the US doesn't allow you to manipulate your body's cells. So whatever comes out of your body is what goes back in your body. And what I mean by that, Fat cells used to be a really attractive option in the US, and it was a very great option. It's expensive, but it worked really well. But the FDA said, nope, you can't use fat cells anymore because it requires a chemical activation process, and that's manipulating the cells. You can't do it. Don't ask me why. A lot of politics involved there, but don't ask me why. You can still do bone marrow. This option is actually going away. You have to go overseas to use your own fat cells now. So let's talk about, so age is a really important factor here when you're looking at doing regenerative medicine. So every day you're alive, you have in your body, you have old cells die off and your body makes new skin cells, or new cells. So like skin cells, for example, your skin cells will live about 2 weeks and then they die off and your body grows new skin cells. Your hair, you have hair that grows, the cells die off, your body grows new hair. Your bones, by the way, your bones in your body gets rid of old bone cells and makes new bone cells about every 7 years. So every 7 years you have essentially a brand new body. Your old cells have been replaced by new cells. So if you've been married for 14 years, you've been married to 2 people. And you're So here's the deal with stem cell therapy. So the problem with this is that as you get older, the quality of your cells decreases. It's kind of like this. So if you took a piece of paper and you made a photocopy of this piece of paper, and then you made a photocopy of the copy and a photocopy of the copy, and do that for 50 years, what does the piece of paper end up looking like eventually?
Blank.
Yeah, it's either black or blank. I don't know which one, but it doesn't look like the original one. So this is why over time, we get gray hair, we get wrinkles, we get brittle bones, things wear out because the copy of the copy ends up being damaged over time. It's a normal process of aging. It's why we all eventually die. But this is important when you're looking at regenerative medicine, because if you're using your own cells, so if you're 50 years old, 60 years old, 70 years old, the cells that are coming out of your body look more like these cells and not like these cells. So one of the reasons we use amniotic cells from the birth process is you're getting cells, like brand new cells that haven't been exposed to life as we know it over decades of time. Does that make sense? So using your own cells, they're not as potent as cells when you were younger. So you remember when you fall off your bike when you were a kid and it heals within a week? Like I have one of these things here, trying to do construction work. This happened 2 weeks ago. It's still there, right? I'm 41 years old. Your body doesn't heal as quickly as it used to. So here's the other factor. So we talked about quality of cells. Now let's talk about quantity of cells. So little baby Silas, for every cell in his body, for every 10,000 cells, he has 1 stem cell, which doesn't seem like a lot. Like 1 in 10,000 seems like a small amount, but babies have tons and tons of stem cells. By the time you're a teenager, that number goes from 1 in 10,000 to 1 in 100,000. By age 50, it's 1 in 400,000. And if you reach the age of 80, for every 2 million cells in your body, you have 1 stem cell. So if you are in this age bracket, using your own stem cells is a great option. Most people that come to this seminar are in this age group or over. Very rarely do we have someone coming in, they're 20 years old, and they're like, hey, I want to do stem cell therapy. It doesn't happen that often. You see it with professional athletes, people have been injured, like football players, soccer players, they're using their own cells. But as you get older, the quantity and the quality of your cells decreases. So that's a big factor. All right, so amniotic cells
Are different from adult cells because they come from the birth process.
That's my voice. Holy cow. At one point, I recorded this as like a recorded webinar. So, yeah. So the cells that we use come from the birth process, and sometimes people get really nervous about. So we're using cells from one body and putting them in your body. So the question is, well, can your body reject those cells? Is it dangerous? Is it safe? And so the unique thing about amniotic cells is that. So here's how it works. This is really clever. So you have a pregnant woman, right? Inside of a pregnant woman's belly is a baby, and that baby is a foreign human being. So why is it that mom's body doesn't reject her baby? Because, for example, if I took my kidney and gave it to this nice lady, what would her body do to it?
Spit it out.
Yeah, spit it out, right? It would kill. So her immune system would say, nope, that's not my kidney cells, and your body attacks it, and it doesn't live in the body that long. That's why folks who have had organ transplants, they need to be on immunosuppressant drugs because your immune system will attack and kill those cells. So if I injected stem cells into you, amniotic cells, naturally people think, well, your body would get rid of those, but inside of the amniotic sac where the baby lives, there aren't what are called antigens. So there's nothing inside of mom's belly that her body would recognize as a foreign cell. So essentially, the same reason a mom doesn't reject her baby is the same reason your body doesn't reject amniotic cells. There's nothing for your body to recognize as that being a foreign cell. So I hope that makes sense. It's it can be kind of a heady concept, but we've done hundreds and hundreds of these injections, and I've known thousands. Like, this is a very, very popular procedure, and it's ultra safe. The labs that process the cells from the birth process goes through the same screening process as if you're going to have a blood transfusion, an organ transplant. So there's very strict guidelines to make sure that there's nothing in those cells that could cause a side effect or rejection. So in other words, like, you can't get cells from somebody who has HIV or hepatitis. Those are screened. So the mom is screened beforehand as a donor, and then the cells are screened twice afterward to make sure there's nothing funky in those cells. All right, so the lab that we get the cells from is processed in a lab. There's something called the AATB, American Association of Tissue Banks. They set the protocols for safety to make sure you get safe cells. All the FDA guidelines are followed. So the lab that we get the cells from is a very reputable lab. They've been around forever. The same cells that I put in my knee, I had this done 5 years ago. I've been a runner I don't run anymore so much because I have kids now and don't have time, but I used to run a lot, and I had a torn meniscus, had this exact same injection done in my knee, and 5 some years later, it's working very well. So really, really safe. So how does it actually work in the body? This is a question I get a lot. So stem cells get all the credit, but it's not stem cells that actually do all the work. So in other words, if you're going to repair a knee or a shoulder or a back, you have to have a bunch of cells to make that process work. So kind of like if you said, well, I'm going to bake a birthday cake, but I'm just going to use sugar. Sugar is the best part of a cake, so that's all I'm going to use. You're not going to have a very good cake. So if you're trying to repair a body part, you need things like collagen, amino acids, enzymes, messenger RNA. All these things work together with stem cells to repair tissue. The reason we use amniotic cells is because it's very rich in all of the growth factors that your body needs. It has all the ingredients essentially that your body needs to repair tissue. So that's why we use it. So how does it actually work? So inside your body, you have these things called cytokines. And cytokines are kind of like the foreman on a job site. So let me give you an example. So they're on lunch break right now, but there's guys, I think it's all Dr. McKinney's family, building this building that he's put to work, right? Cousins and friends.
Yeah, extended family.
Yeah. So he's like the cytokine. So his job is to tell those guys how he wants the building to look. So if Dr. McKinney weren't in the picture, and you have a bunch of guys upstairs working on making a building, what do you think is going to happen? A mess, yeah. Either yeah, a lot of beer cans. Either the work's not going to get done because it's always like coffee break or beer break or whatever, or the job's not going to get done the right way. So the job of the cytokines is to tell the stem cells and all the growth factors where to do and what to go. I think I said that backward, but anyway, you get the picture. So in other words. So this is kind of an illustration. So this is pretend this is like a damaged muscle or tendon or cartilage. So your body says, hey, we have some damage here. Here's the damage. We need to repair that part of the process. Your body releases these things called cytokines. So if you've ever sprained your ankle, you know how it gets like really puffy and swollen? That's called inflammation. The reason it gets inflamed is because your body sends all these extra cells to the area of damage to work to start to repair the problem. So if you have like a sprained ankle, you have cytokines, you have stem cells, you have all these other factors. Your body goes to work repairing the issue. So all these cells are working in that area. And as your body starts to heal it, the swelling and inflammation goes down because your body has fixed itself, right? Like, we don't do the healing. The shot doesn't do the healing. Your body heals itself. It just needs the stuff in there to heal properly. And so your body says, so these little cytokines reach out and they say, hey, we have damage here. We need help. And so the cytokines draw in the stem cells and the growth factors around the area that's damaged. So people ask me, well, if I have a bad knee and you inject the stem cells in the knee, how do they know where to go and what to do? The good news is you already have all the cytokines like screaming like, hey, I need help, I need help. This is why you have inflammation and pain. And it's just all the growth factors and stem cells know where to go and what to do. That's pretty cool, right? So just your body, it's the way your body is designed to heal. So the actual procedure itself, it's a one-time injection. It takes like 15 minutes. In fact, from start to finish, it takes 15 minutes. The injection itself takes like a minute. It doesn't hurt. I don't like needles myself, but I've had this done and it doesn't hurt. We've had some people that are pretty afraid of needles, and it's the most anticlimactic procedure you'll ever have done. So people come in, they get the injection, and You're like, all right, what do I do now? And you just go home. You walk out and you go home. Most people feel results within a couple of weeks. We've had people that overnight they felt awesome. We've had patients where it took them 2 to 3 months before they really started to notice a significant difference. But what you notice over time is that progressively it gets better and better and better as your body starts to heal. So there's really no downtime. The only downtime is for the first 3 days you want to take it easy. So if you have an injection in your back, don't go splitting logs with an axe. Don't go skiing on knees that you've just had injected. Just give it a little bit of time to heal. So just as a recap, you can get stem cells from bone marrow, from fat cells, amniotic cells, which is the one we use. There is a fourth option, which I want to talk about because it's actually the best option. If you have lots and lots of money, buy a plane ticket you can go to the Cayman Islands, you can go to Panama, you can go to Germany, France. So in other countries, they have less restrictions on what you can do with stem cells. So we're all like the Tiger Woods of the world and like the celebrities that you've heard of that have had stem cell therapy, like all the pro athletes, they go to typically Germany, France, and what they do is they take your own stem cells and in a lab, so this is what the FDA doesn't allow us to do, but in a lab, they will grow and culture your own stem cells and they add a bunch of growth factors to it. So essentially what they're doing is they're making a really potent dose of your own cells, and it takes about a couple of weeks, but they inject that back into your body and it is amazingly potent. Any guesses what it costs? It's like, I think it's like 50, 60,000 bucks per joint. So if your job is to hit a golf ball into a hole and you get paid a lot of money, go for it. If you're like you and I, yeah, that's usually not an option for most people. Typically like amniotic cells, if you go to you can go to the Mayo Clinic and have it done, you can go to Harvard, have it done. They charge about 12,000 bucks per injection. Totally worth it. They get away with that though because they have Harvard, the name attached to it, and like we do the exact same thing. We just don't have the prestigious name attached to it. So lots of pros to doing this. No more pain, reduced pain, more activity, less doctor's visits, less injections, money and pain saved on surgery. What's the downside? The only downside is that, let's say worst case scenario, you've spent some money on it, you had the injection, and it doesn't work the way you thought it was going to work. Maybe you thought it was going to get you back to here and it got you back to here or here. That is the worst case scenario. We've never killed anybody with stem cell therapy. We've never hurt anybody. It's ultra safe. But yeah, the only downside is not getting back to 100%. So decision, more medication, more injections. Y'all remember, what this is called? Doing the same thing over and over again, expecting a different result?
Insanity.
Insanity, yes, yeah, insanity. Or, you now have another option, regenerative medicine. All right, so if this is something that, if this makes sense to you and it's something that you want to pursue, the first step is to figure out if you're a candidate. I can't tell you just by looking at you if this would help you or not. So the first thing we do is we look at your health history. We take an x-ray of your joint to make sure that it's not too far gone that we can help. Again, if you've been told you have bone-on-bone degeneration, okay, I've heard that in every single person who's come in our office. What we do, when we take x-rays, we actually teach you how to read your x-rays so you can see them, know what normal looks like, know what abnormal looks like, so that you can make good decisions when it comes to your health. So the first step is a consultation. We take x-rays. There's no charge for that, I don't think, right?
No charge.
Yeah, so come out, we'll look at you, see if you're a good candidate. If we think you're a good candidate, we'll go over what your options are, how much it costs, what the actual injection looks like. Things to bring with you on the first visit. So when you come in for a consultation, if you have a significant other, bring them with you for a couple reasons. Significant others always want to know, what the heck are you injecting in my husband or wife? How does it work? How much does it cost? And they have questions. So bring them with you. It saves a lot of time. If you have any old, you may have some x-rays already here in the office that we can use. If you have like old MRIs, MRI reports, if you have those available, bring them with you. That's helpful. If you had like an MRI 4 years ago and have no idea if the doctor's still alive or where they went or whatever, don't go to the ends of the world trying to track that down. But if you have it handy, bring it with you. Any notes from your other doctors describing your condition, and then also an updated list of medications and supplements. There's a couple of supplements you want to avoid and medications you want to avoid before you have the injection, but it's pretty straightforward. All right, so how much does it cost? So the big question I get is it covered by insurance? If it's not covered by insurance, don't ask me why. It's just like LASIK surgery. If you want to have LASIK, works really well, not covered by insurance, considered elective. I don't know if that's ever going to change in the future. Some types of regenerative medicine are covered by insurance, but not for joints. So this is, I'm going to give you sort of a ballpark price just to give you an idea of what it costs so you can figure out if it's, if it's worth it to you. And so if you tell Dr. McKinney that Dr. Wells said it was exactly this much for my back, I didn't say that. So it depends on a couple of things. It depends on how bad the situation is. It depends on where we're doing the injection. So a thumb injection is very different than doing a neck injection. So the price will vary a little bit, but you're looking at about $4,000 per injection. So it's typically $4,500. When we do these seminars, we buy a bunch of stem cells at once, so we discount it a little bit. So if you need one injection, it's 10% off. So it's about $4,000 for one injection. One injection, by the way, is like one joint. So one injection, like a shoulder would be one joint, lower back would be one injection, knee would be one injection, and so on. If you need two joints, we do 20% off. So if you have, and we do this for spouses as well. So if husband needs a hip and wife needs a neck or whatever, we do that as well. And that is good for, keep skipping over it. So that's good for the next 2 weeks. So we have enough for, sorry it skipped over that, but we do that. Yeah, it's 2 weeks. We offer that price. So again, it depends a little bit on what the problem is, but if it's something you're interested in, the next step, just make an appointment for a consultation, sit down and talk to Dr. McKinney. I may be here as well I leave on Thursday back home. Bring this to this little survey, give this to the front desk, and they'll pick a time for you for a consultation. And if you want to talk to me, I've been doing this for a long time. If you want to talk to me while I'm here, I'll be here again. I leave on Thursday morning. I have to be back at the airport. And in return, we'll give you this little piece of, this is intake paperwork. There's two little sheets to fill out describing your condition. Just make sure to write any medications that you're taking on this little piece of paper. And that's it. Last thing, there are financing options as well. So if $4,000 is a lot to you, that's okay. We had a patient once, she cleaned houses for a living. She had really bad knees. Both of them couldn't clean houses without severe pain anymore. And I think her payment was less than her cell phone bill and helped her immensely. So we don't try to turn people away because of financial issues. So if this is something you want access to and want, and we can help you, we're happy to make it work for you. So that's all I have. Thank you guys for your time and attention. I really appreciate it. I hope you found this valuable and hope we can help you. So thank you. Appreciate it.